So my name is Judith Luker. I work for UCB. I'm based in the UK. I look after patient engagement for epilepsy in Europe, and I have a particular focus on the rare epilepsy syndromes. So SUDEP is basically, well, it depends how you define it, to be honest, but SUDEP it's what it says on the tin. It is a death in an epilepsy patient that is not explained. And in many cases, it is not anticipated or expected. There are deaths that will occur in epilepsy that are related to the condition, for example, through a fall or an accident, or for example, tragically through, for example, a driving incident. And I was recently at the PAMI meeting before the AAS meeting in December last year, and there was quite a robust discussion about how people define SUDEP differently. But for the purposes of the piece of research that I presented last year, we were talking about those cases where, very tragically, you have an epilepsy patient who dies unexpectedly and people don't know the reason. It was secondary research. It was a literature review. It wasn't a piece of research looking at the incidence of SUDEP. It was a piece of research trying to understand the extent to which the risk of SUDEP is communicated to patients and their families. And the literature review we did, we used PubMed. We ran it from January 2013 to April 2023, so just a touch over 10 years. We were looking at search terms, SUDEP, obviously, counselling, education, caregiver, clinician, because we were trying to get both perspectives in the research, the caregiver perspective as well as the physician perspective. And we identified just over 170 studies, 172 studies through that search, and 60 of those were about SUDEP conversations. We wanted to understand the needs and the experiences that people with epilepsy and their families have when it comes to these conversations, but we also wanted to understand physician attitudes and behaviours when it comes to those conversations. So what we found four main things. We found, from the patient perspective, we found that the majority of people who have epilepsy or their families wanted to be told. They felt that they had the right to be told about SUDEP. They also felt that knowledge about SUDEP would give them at least the opportunity to take risk mitigation measures. The research also told us that where there tragically had been a death from SUDEP, bereaved families felt that when they hadn't been told, it was such a shock because they didn't even know it was a possibility. And they felt blindsided and they felt angry that they hadn't been told. They also expressed feelings of regret and guilt because they felt that if they had known about the risk, they would have at least had the chance to try some risk mitigation measures. Now, we know that the very nature of SUDEP is that sometimes it simply can't be avoided. But these families said that they just wanted to at least have the opportunity to try mitigation, and they felt that they were denied that opportunity because they didn't have the information or the knowledge. The other thing, the fourth thing that we found from the research is that when information about SUDEP is given to people, there are either no or very low adverse effects on overall health. And in fact, there's a hypothesis that could increase the likelihood that they could improve their seizure control. I mean, we absolutely found with the research that there's a gap between what I've just described and what's being experienced by patients when they have their conversations with physicians. We found that most physicians agree that it's important to talk about, but we also found that fewer than 12% of them are discussing it more than 90% of the time. And the reasons that we found that physicians were given for that was lack of time, perceived emotional reaction of patient or their caregiver, anxiety about affecting their quality of life further, the feeling that it's just another piece of bad news for them to take out of the room, belief in the ineffectiveness of preventative measures, and sometimes an assessment that the patient is at low risk of SUDEP. So when you've got all of these reasons for not having the conversation, it's quite difficult to jump to how to do it, because the first challenge seems to be to confront this gap between those reasons that physicians are giving and then the appetite for information, for want of a better way of putting it, that patients and their families have expressed, because there's most definitely a gap. But we did cover, as far as we could, what good looks like when it's happening. And what we found was that in person, I think that this is self-explanatory, but face-to-face is so important for such a difficult conversation. Unscripted conversations make it much better. And again, with any difficult situation, anything that is free-flowing and empathetic and unscripted is likely to be more successful. Supported by educational materials, again, is seen as best practice. And the other thing that came up was good practice is checking retention of the information and following up after the conversation, because there's at least one study that shows that when people have been told about the risk, they don't necessarily retain that information, because it may well be in a situation where they're being overwhelmed with so many different pieces of information. Or it may be that, you know, we all have situations where we don't always take on board a difficult message immediately, and sometimes it needs to be repeated. So those were the best practice things, you know, in person, unscripted, supporting material, and then a repetition just to check. One of the things that really came through so powerfully for me and really struck me was the impact on the trauma and grief when families had no knowledge of the risk. You know, if you lose a family member to SUDEP, it's the most appalling tragedy in your family, but have that grief compounded by the trauma and the shock, that was something that came through very powerfully. I just feel it's an important thing for physicians to hear, because it's not something you would necessarily jump to intellectually, and to understand that you could play a role in managing that should the worst happen, I think is a helpful thing for them to understand in the mix of other things. The other thing I would say is that there does seem to be this very interesting tension, because physicians talk about how it is important to counsel about SUDEP. They acknowledge that it's an important thing for people to understand. Yet the research is telling us that they're not routinely having the conversations. And some of the reasons they give for not having the conversations are around the anxiety of the person in front of them, and anxiety about affecting their quality of life and making their life even worse by giving them another difficult piece of information. So there feels to me like there's this tension between the physician really wanting to protect the patient from bad experiences by not having the conversation and confronting it, but at the same time they're potentially making a bad experience worse if they don't have that conversation. And I think it's important to find ways to explain that, and much of what we've been trying to do with this piece of research is to bring that patient and family perspective up to the same level as the physician perspective, so that we can sort of mirror them together and then see if there is something that could be done to kind of close that gap. So this study didn't cover that. This study looked at the communication of the risk, but it did touch on that indirectly, because, as I've mentioned, one of the key things that came from patients and caregivers was this feeling that they wanted to mitigate risk. And if a family is told that the patient is could be at risk of SUDEP, if they're told that SUDEP is a risk, they at the very least have the opportunity to try and reduce the likelihood of seizures. So, for example, if you have an older child who has got to the stage where they can maybe go to college, it's very helpful to know about the risk of SUDEP and understand the importance of not sleeping alone, understand the importance of adhering to your medicines to reduce the likelihood of seizures, to understand the impact of going out and having lots of fun and not having lots of sleep, or maybe getting stressed about your studies. All of these things are things that are important to think about if you know that there's an underlying risk, and that's just one example. But it is, in the view of the people in the studies that we covered in this review, the view that they had was that they wanted to try and mitigate the risk in those sorts of ways if they could, because at least they were given a chance to try and reduce the risk.